Hello, everyone. On behalf of the Spina Bifida Association staff, welcome to the SBA's Community Information Session, during which your questions about skin health may be answered. They will be answered, and we're glad that you are here to ask them. My name is Judy Thibodeau, a member of SBA staff, and I and my colleague, Juanita Panliner, will be with you for tonight's presentation. The session will be presented by Jennifer Wilhelmy. Jenny has worked with adults with childhood onset disabilities for more than 30 years in group home, clinic, and hospital inpatient settings. As an adult nurse practitioner at Gillette Children's Adult Services, she provides physical medicine and rehabilitation services and wound care. Jenny has a Bachelor of Science and Master of Arts in Nursing, is a certified public health nurse, is certified in wound care, and is board certified as an adult nurse practitioner. The health of one's skin is important to all, and of particular importance to people with spina bifida. People with spina bifida usually have areas of the body where feeling is absent and skin breakdown may go unnoticed. We are grateful for Jenny for this session on a matter of great importance to our community. Before we begin, a few housekeeping notes. If you have a question or comment that you have not already submitted to us, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible. You will receive the recording of this session and an evaluation survey after this session. Please take a minute to complete the survey so that we will learn what topics are important to you for sessions like this in the future. Lastly, today's event is being recorded, and we will post the video to our website soon. Now on to our program. Jenny?
Thanks, Judy. It's great to be here at Ask the Expert, looking at skincare, highlighting things you can do to help keep your skin intact and healthy. So first, some shout outs. Amy Safel, she's a lived experience partner who SBA created or contacted to help me. She helped me create the content and kind of focus my ideas on how this would be the most helpful for your community. SBAA for sponsoring the event, and of course you for attending, being open to learn and grow. It's just so important as we enter this topic. So what are the common skin concerns in spina bifida? If you've heard my presentations before, the things that I see most in my clinic are pressure injuries, but incontinent dermatitis, burns, and athlete's foot are often things that come in as well. And so although we're going to highlight pressure injuries today and that prevention, I want everyone to be aware of things that can impact your skin and cause concerns for you. So grounding ourselves in the research of the Spina Bifida Registry is always important. Kim et al. Explored factors that were associated with pressure injury development. And 26% of the patients in the survey for the registry reported having a pressure injury, 19% in the past year. So this is something that a lot of the spina bifida community are experiencing, and therefore we want to continue to highlight it year after year on its importance to the community and staying healthy. So if 1 in 5 of our patients, friends, family members with spina bifida have a skin issue that might be preventable, how do we look at reducing the odds of developing these skin issues? With that focus on prevention, because it's so much easier to treat something in the early stages than it is in the late stages. Our work with the CDC and the Spina Bifida Association came out with this campaign years ago, the Did You Look campaign. This is still my favorite piece of that campaign because it's one page. You could even print it out from today's presentation, throw it up on your mirror or your dresser, just to remind yourself, did you look? Healthy skin starts with a look. Looking at prevention, conducting daily skin checks, controlling moisture, avoiding pressure, eating right, acting quickly, and I love that signs of trouble. You know, if you see something like that, you should be seeking medical attention right away. And we'll talk about what those community resources might look like. Here's some of our most common pressure offenders. I love to have this slide to look at what are the things. These are all reasons people came to my clinic with pressure injuries, from recliners to CPAP and BiPAP equipment, orthotics, poor seating, even slides at the playground or water slides at a water park. All reasons that folks got pressure injuries. And that good old family road trip, which we highly encourage, but we need to prepare for. So if we're in the car for a long period of time, taking breaks to offload pressure from our skin and checking the skin at each rest stop to make sure that there isn't an area that's red or starting to break down. What are those risk factors? And so although it's kind of more glamorous and cool to talk all about how to care for wounds, if we could prevent them, that would be even cooler. So what are the risk factors for skin breakdown? Well, number one, poor or absent sensation. If you can't feel the skin or see the area, you're unlikely to know that changes are starting to occur. The presence of incontinence and moisture, heat, inactivity and immobility, poor nutrition or hydration, and just kind of a generalized decrease in physical condition, all can be risk factors. So
Jenny,
let's look at these.
Jenny,
Yes,
will you, at the request of a member in the audience, define what we're talking about? What is a pressure injury?
sure. Yep. We'll get there, but yes. So a pressure injury is an area of skin breakdown that occurs generally over a bony prominence or as the skin comes into contact with an external force like an orthotic or a wheelchair cushion. The outside of your skin and the inside, it gets squeezed together, creating a lack of blood flow, which then kills some of the blood supply and then causes those skin cells to break down, causing a wound. I'm going to have some pictures of that coming up so that you can kind of see what that looks like. If we go back a slide or two, we can see, and I don't know on mine, let me see if I can move this down. I don't know if you guys see what I see, but right here, pressure injuries. This is actually the bottom of somebody's foot. So foot came into contact with the bottom of a shoe, and either something was in the shoe or the shoe was too tight. So it restricted the blood flow between the bone in the foot and the skin, cutting off the blood supply and creating a pressure injury, which would then occur in this area. So that's an excellent question. And I appreciate you for grounding us back to the basics, which are essential. So many of these types of skin challenges just start out as redness. So you may just see redness that doesn't go away within 15 minutes or so. That's kind of your body's way to say, hey, we need attention in this area. And what are the things that you need to do to help protect the skin in that area? So when we look at all sorts of skin breakdown, whether that's from incontinence or from pressure or from sliding on things, burns, there are ways that we can look at our skin to help prevent these things from happening and look at risk factors within our environment. And so this is the first thing that I want everyone to do if you haven't already done that. How good is your own sensation, and can you map out what are the trouble spots so that between you and a care partner or a healthcare provider, a parent, a spouse, can you label the areas so that you all know on this little diagram which areas you can't feel or see very well? Because these are going to be the areas we really key in on when we're doing a lot of this prevention work. So looking at sensation is different for everyone. Every time that I see a patient in clinic, I ask them to kind of show me first, where does your sensation change as you go down your body? And this may depend on the level of your lesion from your spina bifida. But can you feel, some people can still feel light touch or a pinch. Some can feel pressure. Some can feel changes in temperature. But getting to know your body the best will really help you to be successful in prevention. And I would love for skin checks to be just as frequent as brushing your teeth. So when you're doing your teeth in the morning or in the evening, looking at your skin, looking for areas of redness, blisters, sores, cracks, peeling, swelling, anything that doesn't look like it did the day before. Feeling skin for hot areas, and then using a mirror if you can't see well. You see that our mirror there has a little sticker on it that says, "Did you look?" Just to remind people, like, let's look at the areas and hold those up. There are also more savvy technology out there and our cell phones have gone a long way towards helping us too, where we can use the camera on our cell phones to see things that we couldn't see before without the use of a mirror. And then you see that little shoe down there. Every time you put shoes on, checking to make sure there's nothing in your shoe. This has a whole pile of rocks in it. So obviously it's kind of an over exaggeration that you don't want to put your foot into a shoe with full of rocks. But often I'll have patients come in who just have one small rock in their shoe, or the fabric inside the shoe has become wrinkled and now is creating pressure on the foot. So checking the inside and outside of your shoes before you put them on is essential. And then washing and moisturizing. It's super important to wash your skin every day and if needed, and to check the temperature of the water. Some people like to use a thermometer to do that. They make a lot of different things that you can get on Amazon where you could, throw a rubber ducky in the bathtub and it will, if you pick it up, it'll tell you if the water's safe. So just different things that will help you to make sure that you don't burn yourself when you're washing and moisturizing. Use mild soap, soft towel, and the key to this, and we'll talk about this at the end with foot care as well, is that you're taking that towel and you're drying in between each and every toe. And if I was more flexible, I could pull my toes up here and show you, but that just would not be a good idea at this point. So you'll take the washcloth and you'll wash in between every toe, and then you'll take the towel and you'll dry in between every toe. It's really important to make sure that you don't put any moisturizer between your toes, because it just adds for increased moisture and can lead to, different fungal infections. So making sure that the skin is very clean and dry. Wearing braces. So looking at the braces that you're wearing, does the Velcro need to be replaced? Are there rough edges? Is the padding on the inside wearing out? You should be seeing your orthotist who made your braces at least one time per year to have just general maintenance and check of the brace. And then as needed, if you see reddened areas that don't go away within 15 minutes after the brace is removed. Another risk factor is immobility and inactivity. How much time do you spend in your chair, in bed, in a wheelchair? And if you are, how can you remind yourself to make slight, frequent changes in position? Because you're insensate and the skin is insensate, your body isn't sending you those natural kind of nudges to shift your pressure from side to side. And so if you think of, you've got two sitting bones, right under each butt cheek. And if you sit, the longer you sit and don't move, the more that pressure can restrict the blood flow in those areas and lead to skin breakdown. So for a lot of patients, they're setting timers. They're using their Apple smartwatches, not to advertise any one, because I think there's other smartwatches, but smartwatches that give you kind of that nudge, move, you can do it. Time to get active, just to do some simple weight shifts as you're going throughout your day to relieve pressure and to protect your skin. And then looking at another risk factor, inadequate nutrition or poor hydration. So your skin needs a lot of moisture from the inside to stay healthy. So drinking enough water, making sure that you're eating a balanced diet full of fruits and vegetables, healthy meals, trying to limit screen time. Now, does screen time protect your skin? Just because you're looking at a screen doesn't mean that you're going to get skin breakdown, but the longer you're sitting on a screen, the less mobile you are, the more likely you could get skin breakdown from being immobile. So focusing on that can be important as well. Heat. We're approaching the summer in Minnesota here. We are having our first 70 and 80-degree days, and then we have to shift our mindsets from frostbite. If I was talking in the winter, I'd be talking about protecting your skin from cold. Now we have to shift and protect our skin from heat. So checking the bath or shower before you're getting in, probably at least one time a year, a patient will come in with a burn from a bath or shower. Checking the temperature of surfaces that you're resting against or sitting on, lawn chairs, curbs when we have our summer parades, pool decks, anything, seats within the car and seat belts, checking that temperature so that you don't get burned. Avoiding walking barefoot outside, and then avoiding sitting too close to a radiator or heat source in cold weather. I've had one in my career of a patient who sat too close to a campfire on a camping trip. And so if you imagine this camping trip was around this fire where they're roasting marshmallows, it wasn't until the next day when she went to take off her jeans. And kind of when we camp and it's rugged and out in the wilderness, sometimes we don't change clothes frequently. We're kind of in it for a longer period of time. But when she took off her pants the next morning, the jeans were kind of stuck to her skin because she had actually suffered a burn because she sat too close to the campfire and couldn't feel that. So making sure that we're keeping the appropriate amount of distance to protect our skin from things like campfires. And then prevention as far as overall physical condition, attend to your own needs. Use reminders for pressure relief and for catheterization. Catheterization of your bladder is so important as we try to control the amount of wetness in that peri area. Because if we add increased wetness to pressure, the breakdown happens that much faster. Monitoring your legs for swelling. If you wear compression stockings, making sure they're going on early in the morning when you get up, and then you're taking them off at night. Because if you wait till partway through the day to try to get them on, that swelling has already taken effect. And getting those socks on is going to be difficult, and it's going to put your skin at risk since you're putting something tight over something swollen. So if you see these ankle creases, and that's where we'll see skin breakdown from TED socks. If they're not fitting correctly, you'll get skin breakdown right through that ankle crease. So it's super important that we're wearing the compression stockings as they're ordered, and checking the fit at least every year to make sure. We're kind of on a rotating, I think insurance in our area, you can get a new pair of socks every 3 months. And so people are on a kind of a continuation of, getting new pair on a routine basis because they do wear out pretty frequently, and then they won't have their compressive abilities. Check surgical scars for any thinning or breakdown, especially if they're over a bony prominence. This can be really noted over hips. If you have a history of orthopedic surgery on your hips, it can make that skin in the area of the incisions just a little thinner and weaker. And if you have a rash, itching, any open areas, make sure you consult with your clinic team for management. So what are some do's and don'ts when it comes to skin protection? I think a first thing is, if at all possible, to use your footrest for good alignment. When feet are dangling, they're not protected. They're also at risk for fracture if they get caught on something as you're wheeling by, increased edema. And when your feet are in good alignment, that can help to reduce pressure at the back of your knees, as well as on your buttocks if you've got everything in alignment within your chair, so that will evenly distribute the weight. Try to wear loose fitting clothing because tight clothing impairs circulation. Jeans are really known for this, and I can totally sympathize. I have quite a few patients over the years who bought jeans that were a little bit smaller than what they needed because they stayed on better when they transferred from surface to surface, which I totally get. But because they couldn't feel the tightness of the jeans, they ended up at that trunk crease where the jeans would button, ended up with pressure injuries in that crease from wearing clothing that was too tight. So just being very mindful about the type of clothing. And then using some type of lap board or protective heat resistant cloth when you're cooking. Microwave popcorn is famous for this. So you throw your microwave popcorn in, it's done. You open your microwave, throw that bag in your lap and wheel to the next place to get your soda or of course water if you're doing really good with your hydration and healthy eating. And the steam coming out of that bag burns the thighs if you're not wearing some type of protective layer while cooking over that area. So some things that are really important to do, every 5 to 10 wheelchair push-ups every hour. So lifting yourself up and down. You don't have to hang out there. You're just giving your body the natural way to get blood flow back to those sitting bones and protect the skin on your buttocks. Being careful during transfers not to scrape or bump your legs. What I've found is that for some folks that really don't feel their legs, when they're transferring, it's kind of like bumpers on a pinball machine. Their legs are bouncing off of all different things because they don't feel them, and that puts them at increased risk for injury. Checking the temperature of car seats. We talked about that. Those can get very hot. Wearing long pants when crawling. Some of the patients that I see also wear knee pads when crawling, just to protect their knees and the skin. Avoiding kind of concrete, rough surfaces, hot surfaces. Trying to get your feet up as much as possible to decrease swelling. So when you're just kind of hanging out in the afternoon, reading a good book or doing something, getting out of your chair and getting your feet up above the level of your heart so that you can decrease the amount of swelling that's occurring. Taking your shoes and socks off when you go to see your primary care doctor or you're at your spina bifida clinic, because your feet are at such risk because it's kind of that last end of the blood supply and they get so much wear and tear. So if you take off your shoes, then people are more likely to kind of take a peek and see what's going on. And then calling your provider if there are any injuries to the foot or leg, even if it seems minor, fractures can happen. And if you don't feel it, it can take days for that to kind of start to swell or bruise or cause other challenges. So high risk for fractures when you can't feel your legs. And here's some don'ts. Don't put a hot hair dryer or curling iron in your lap. And most of these have come from just personal experience throughout the years with people coming into clinic, avoiding hot food, liquids, or plates in your lap, getting too close to fireplaces, radiator, hot water pipes and baseboards, elastic bands at the waist and ankles. So making sure that the clothing you're wearing, again, is not too tight where it can cause pressure injuries. Even crossing your legs for a long period of time can cause a pressure injury. So making sure that you're moving around, getting yourself into different positions. Bare feet on hot or cold footrests. If you have the footrests that are made out of metal, these can get hot and cold as well. So making sure that they're a safe temperature. Or if you have access to getting them customized and padded, doing that as well. And then smoking and vaping, as a general rule, decreases circulation and can cause some more challenges with wounds and with wound healing. And a whole list of other things that's probably for another presentation. Summer tips, wear a hat, drink lots of water, wear sunscreen. In the good old days, we used to have those great spina bifida family conferences, and they were generally in warm places with great swimming pools. And people struggled with, especially if you're barefoot, not remembering to put sunscreen on the tops of their feet and to wear pool shoes when you're in the pool and on the pool decks, because those are made to be anti-slip. And if you can't feel, I had a patient, I believe it was 2 summers ago, that went to a water park and forgot his water shoes. And it was a full year of healing the bottom of his feet after the damage caused by the pool deck. Just walking, doing his normal things, having fun in the water park and walking around there without any kind of foot protection. So it's super important that you protect your feet in pool areas. So prevention, truly, truly, it's possible. But it's hard because I know people have a lot of other things that they have to do, but it can be as simple as a look, doing daily skin checks, looking at all areas, not just those that are at risk, but just kind of a good head to toe, trying to control moisture as much as possible. And the two high moisture areas are that peri area, whether that's from incontinence or perspiration, and feet. Because we know that, AFO socks and then AFOs or other types of braces and then good shoes, all of those create moisture. Custom seating is amazing, but again, it's usually made out of a thicker foam that causes heats, and so when you're sitting on that all day long, you can get sweaty and that can cause excessive moisture. And then avoiding pressure whenever you can, eating right, getting enough fluids, and acting on areas of redness quickly is super important because I'd rather see you in clinic with a red spot and we both like take a deep dive to figure out where it's coming from than a hole in your skin, which is harder and longer to fix. So you sent some questions in, and so we're going to take some time, and this is what came to me as of today. There'll also be some time at the end, to talk about that. But here are some of the questions. One was having painful, burning itchiness, a lot of skin flaking off. I'm 71 and becoming less mobile. So we'll talk about that and what that might look like and what some of the causes of that might be. Another thing that came through, I recently recovered from a stage 4 pressure injury. So for those of you that don't know, and this could be another presentation that we give, there are 4 kind of stages of pressure injury. One being just that superficial redness. That's where I'd love to see you in clinic. It's red, it's not going away. Let's work together to figure out how to prevent it from going to a 2, which is a shallow ulcer, kind of like when you scrape your knee on like cement, you just get a very shallow ulcer. 3, down into more the skin and the subcutaneous or fat layer. And then 4, which this person was talking about, is generally a pressure injury that goes down to the bone. So we're actually seeing bone and muscle exposed throughout the wound bed. These can take years to heal. They can be life-threatening. They can cause amputation. And so it's just essential that we try to get people in and getting attention at that 1 and 2 stage. There's also something called the deep tissue injury, which looks more like a bruise, but indicates there's more tissue damage underneath the skin, as well as an unstageable pressure ulcer. So where there is more of a scab over the pressure ulcer, we don't know how deep it is. So we'll talk about some of those things as we go through. Somebody else said, do non-diabetic ambulatory spina bifida adults need to keep podiatrists on their regularly seen team? I'm having issues finding care in a small town with straight Medicare. So insurance and access issues can also be frustrating. And so we'll talk about some other resources that might be available in your area. And then someone commented or asked the question about why do pressure sores take so long to heal? So we'll look at that as well. So first, looking at that first question, aging and skincare, this kind of brought me back to looking at, how does your skin change as you age? Because it isn't uncommon for a family of a young kid with spina bifida to go several years, many years without a pressure injury. And then as the teenage years come, and then into the 20s, and then into the 30s, there are more and more skin concerns. And they said, this never used to be a problem. Well, everybody ages a little bit different, but you will notice that as you age, your skin becomes drier, your skin becomes thinner, it might be more itchy. It might irritate more easily, be, bruise more easily. You actually sweat less, which isn't necessarily a good thing, and you heal slower. So if you compound that with the fact that you're not feeling some of those areas, that can just be kind of a recipe for skin breakdown. So one of the things that they recommend through the American Academy of Dermatology is to routinely bathe to relieve dry skin. And what I'm seeing in clinic is that bathing, the older you get, bathing becomes more and more challenging, whether that's based on mobility, access to care partners. And so people tend not to bathe. They tend to do just kind of some bed baths, and they're maybe not getting as clean and as hydrated as possible. So routine bathing really can help to relieve dry skin. Some people need to use a humidifier within their home if the air is too dry. We also need to protect our skin from the sun and to go fragrance free on skincare products. So trying to look at products and making sure that they're not containing a lot of dyes and I say odors because I'm a sensitive to smell person, but we don't want a lot of perfumes and those kind of things in our skincare products. We just want basic hydrating skin products. And you can ask locally to your primary care physicians. They usually have a line that they like to use and what's available in your area. But moisturizing frequently can be important. And that looks usually at like doing it every day, as well as, I didn't include in this slide, but the use of a barrier cream. So if you are incontinent, doing a really thorough cleaning job and then using a thin layer of barrier cream all over the skin that might be exposed to urine to help block out that urine. If you think of a sponge, the more water you add to a sponge, the bigger it gets, and then it starts to fall apart. And our skin is very similar to that. So the more moisture we add, it really can cause skin breakdown, as well as skin under pressure that's also too wet increases the risk and the severity of pressure injuries. And then this little center purple thing just talks about like what are the things, cleaning gently, moisturizing frequently, avoiding sun exposure, eating right, not smoking or vaping, trying to get into a routine. Like we said, oh, I brush my teeth every day, so I'm going to take care of my skin every day. And then, our body is better when we avoid stress. So trying to look at our own stress related practices and how we can reduce stress in our lives.
Jenny, there
Yes.
is a question. What is something to use other than perfume?
So when I'm talking skincare products, I'm talking about products like a brand name would be like CeraVe or Lubriderm, where it's just the cream and the products. It isn't a smelly kind of fragrance that's added to it. If you're just talking about perfume, like let's say you really love a brand of perfume and you want to put a little dab, on each side of your neck or those, that isn't going to impact your skin. It's trying not to use. Probably the best store example is if people are at have a Bath and Body at the mall, Bath and Body Works, you walk in there and you're just like hit with perfumes. All of their products have different perfumes and stuff, and those can cause skin sensitivity to occur. And so trying to take those out of your wound care routine. Not wound care, skincare routine. I guess I see too many wounds, so I usually talk wound care routine. But but if you want to wear a little perfume to kind of spice things up for your life, that is totally fine. This is just trying to avoid them in some of those products. Another product is like Eucerin. You think about Eucerin or even Vaseline. Vaseline is an excellent moisturizing product, but again, it doesn't really have a smell. It just has the different essential ingredients to help hydrate and protect your skin.
We also had a question about if you could please give an example of a barrier cream.
Sure. Yeah. I have no financial backing from any wound or lotions products. Nobody pays me to do this work. But my favorite one that you can get on Amazon is Critic Aid Clear. Just for that reason, it goes on clear. So when you put it onto your skin, it just leaves a shine to the skin. Give your booty a little shine, and it keeps the urine out. And if you, let's say you had an accident, you know, because we're speaking frankly here and accidents happen, but let's say you have a stool accident, that stool can be very acidic and really harmful to your skin. But if you're wearing a barrier cream every day and you're putting it on in the morning with accidents and at bedtime, it'll help to protect the skin from any type of bowel or bladder incontinence. So I love Critic Aid Clear, Vaseline, A&D. These are all things that are readily available at your big box stores or local pharmacies. But you can get them, unfortunately, and we try to work on this year after year. Insurance doesn't cover barrier creams. They should, because it would save them a lot of money in wound care. But they typically are not very expensive, and you only need a very small amount placed, you know, rubbed in that area. You shouldn't see any clumps of cream, or it should just be a shiny surface over anything that's exposed to increased moisture.
Thank you.
Yeah, you're welcome. And so the next question on our list was about podiatry, and podiatry can really be tricky for many reasons. If you are connected with a podiatrist and they are helping you to take care of your feet, just embrace that, because that is amazing. But that's not the norm for a lot of folks. I found in our area in, you know, the Twin Cities, St. Paul and Minneapolis, Minnesota, a lot of podiatrists don't want to cut toenails. And so patients go there and they just don't get the service that they need. So Gillette did design this little instruction for the professional pedicurist card that people could take if they had somebody else helping them outside of podiatry to cut their nails, that talks about, you know, using warm water, using a soft towel, drying the bottoms and between the toes, you know, applying moisturizer, trimming the nails straight across and smoothing them with an emery board versus cutting them in a rounded surface that would put you at higher risk for ingrown nails. So you can certainly, you know, print this out once the slides are available, take that with you. There's also this great, this came out a while ago through the government, Foot Care for a Lifetime, but I did like how it talked about using a mirror here. You can see they're looking at the bottom of their feet with a mirror, looking in between the toes. This is, you know, a heavily calloused area. We will see that happen with different orthotics where things need to be modified because they're getting this heavy callus. A callus is just your body's way of telling you this area is under pressure. Sometimes those calluses open up to wounds, other times they don't. But I love this kind of daily self-inspection or inspection with a partner, because we know not all people can do this independently, and that's okay. But just knowing what your caregivers too should be looking for. And doing this kind of before you put on your shoes and socks, after you take off your shoes and socks, and orthotics if you're wearing them, and kind of just making sure that you're taking care of your skin. So if you go, this link goes to their website, which talks about a lot of different foot care routines. There's also in the community resources, we'll be looking at some things as well. All right. Another question was, why do pressure injuries take so long to heal? So what I tried to do is think of like, and my face is kind of getting in the way here, so I'm going to kind of hold it here. But they take so long to heal because there's so many things to balance, which is why if you are checking skin and finding things when they're just red and seeking attention, medical attention, or just a partner to look at why it might be red, it goes a long way, because once there's a wound, it can take years. I have a few people that their visits now are called palliative wound visits because their wounds are not going to heal. And we're just keeping them as healthy as possible and keeping the wounds manageable so that they're not affecting their life too much. And that's just a sad situation. So they take long to heal because the key there in the center is that you've got to have pressure relief, pressure relief, pressure relief. I could have $1 million wound dressing, and it could be made of the finest what somebody brought me recently, skin grafts made out of fish scales. So these were supposed to be, the latest and greatest to healing wounds. But if you don't take the pressure off to that area, it's not going to heal. And so pressure relief becomes the biggest challenge. And I totally get it, because for folks that are wheelchair users, that's how you get around. And so for people to say you can't be up in your wheelchair, that can affect your work, that can affect your social life, that can affect fun times. It's just so challenging. But if we don't get the pressure off, we're not going to get the wound to heal. You need good topical wound care, good nutrition with lots of protein, and protein can be expensive and not as accessible as carbohydrates. And then staying hydrated. And then kind of along the outside is all the stuff that just really gets in the way. So if your equipment doesn't fit right, that could prevent your pressure injury from healing. If you don't have the right balance of moisture at the wound bed, that can affect, and take longer to heal. If you have an infection, I know SBAA and at Gillette, we both have had reports of individuals that have gone into the hospital with sepsis. Sepsis is like severe infection, and it is life-threatening, and people have died from wounds. If you think about Christopher Reeves, who's Superman, he had all the resources in the world, and his end of life came from a pressure injury. So just making sure that we're watching for signs of infection. It can be hard to keep dressings in place. That can be super hard. You can't see or feel the area. So it really doesn't come like top of mind, like I got to do something about this, because you can't see it and you can't feel it. If you don't have a care partner to help you to either manage the wound dressings, just do the repositioning, any of those things, lack of medical care, no time to be off the wound, no access to dressings. Insurance has made it extremely difficult to get the right amount of dressings for the right wound at the right time. And we just have to fill out so much information just for you to get a very small amount of dressings. Foam dressings, people love foam dressings, but in the state of Minnesota, and I think this is true in other places, no matter what your wound looks like, they only want to cover 12 per month. Well, there's 30 days in a month, and sometimes you need a couple a day. So access becomes a big issue. Wounds also like to stay at consistent temperature. So if that dressing's going on, off, it's losing its moisture balance, and it's also losing its temperature, which prolongs its healing. So there's just so many factors to pressure injury healing that it isn't surprising that patients this journey will take them, 6 months, 9 months, a year, or that they'll have a palliative wound case where we're just protecting them as much as possible, keeping them out of the hospital, but we don't expect those wounds to heal. And then, what are some community resources? Looking at, if you have a spina bifida clinic near you, checking in with them and seeing them routinely to make sure that you're getting, the care that you need and the screening that you need, and education about prevention. Some people do have access to podiatry. I don't have a lot of good tips and tricks for if they don't take Medicare, if they don't take medical assistance, but you certainly can check. Dermatology tends to see more kind of the rashes, the moles, skin damage from sun. They do screening for skin cancer, so that's still important. They just don't generally treat burns, incontinent dermatitis, or pressure injuries. Primary care is probably going to be your first stop when skin concerns are noted, and that's totally fine because they should be able to get the resources to connect you with wound care. Seeing your professionals, your orthotists who do brace fits, checks, modifies, seeing them at least once a year is important, even if you don't have any skin concerns, just so that they can check to make sure things don't need to be modified due to wear and tear. Same with seating professionals. So checking the seat, the back, positioning within the wheelchair. These are all super important. there is here a link to find a WOCN nurse. So WOCN stands for Wound Ostomy Continence Nurse. This is a certification of nurses that are often throughout different healthcare systems that see patients or are part of wound care clinics. And you can click on that and look for ones in your area. And then I just did a quick search in my area on kind of toenail help, because people are often looking for someone to help them with foot care and toenail care. And this is also another area where nurses have creative mobile clinics that happen throughout senior centers, come into, and I know not everyone on this call is a senior, but we all need help in one way or another. But they're actually nurses that are certified in foot care and do toenail trimming and skin care and check feet for wounds. And a lot of that is done on a sliding scale fee versus insurance. So people have found that really helpful. And so you can Google in your own area to see if there's any RN foot care available. This one is for the St. Paul area, but they had a lot of great resources that were available. And so now, I'm going to stop sharing and kind of open it up for dialogue. There's so many things to talk about, and so I know it can be overwhelming, but there are really some simple things people can do just to start on this path of prevention. And if nothing else, to take action early if they see areas of redness instead of waiting for it to become a larger, harder to deal with wound.
Jenny, will you speak about wheelchair cushions?
Yeah, I mean, there's a lot of wheelchair cushions out there, and all of them get worn out. So I think the biggest thing that I see in clinic is people coming in with equipment that's way past its due date. So that's why I'm encouraging everybody to check in either with your wheelchair vendor, or if you have, like at Gillette, we are very fortunate to have a custom seating department that crafts this seating for us. But to be checking in with them once a year to make sure that your equipment is in good use. And to know when you're picking something out, if it's going to fit into your life. If you pick out, not to name brand names, but a lot of people love a good Roho cushion. Those are the little air fingers in the cushion. But you got to check those every week and make sure they're properly inflated. And if that doesn't fit into your life, then you'd want to choose something else. But there's a lot of really great options for pressure redistribution in wheelchair cushions. We just got to keep them from getting worn out and get them replaced on a routine basis. The other thing is to make sure when you are talking with, I think vendors have become very savvy, but I would always, when I'm talking to a wheelchair vendor about my next seat or whatever, reminding them that you can't feel your skin, you know what I mean? And that you can't just sit on a standard cushion. You need to have skin protection properties with that cushion.
Jenny, we've got a couple questions, but I want to ask you one more.
Yeah.
Talk about when you have got a healed skin breakdown spot.
Yep.
The propensity that it might break down again.
Yeah. Some of the studies show that you lose about 20% of the strength of the skin when you've healed it, so it's not healing to 100%. So in that situation, depending on where it is, you need to protect it from moisture, from pressure, from heat. And so just that simple adding of a barrier cream, if it's in an area where incontinence can happen, can go a long way towards keeping that skin intact. But that's why it's so hard in this community to see younger kids getting these severe wounds, because it's setting up kind of a lifelong struggle with wounds when we've lost that much skin strength so early.
Jenny, do you recommend powder?
Powder is great for feet. So powder is good for moist areas. The other part you might see powder under is like pendulous breasts. I know it's, we're laying it all out here today, but some people just have larger breasts and then you get moisture build up underneath there. So using a good powder, the key to powder is that you want to clean the area thoroughly, dry the area thoroughly, and then massage the powder into the area. I see some people that kind of sprinkle it like they're sprinkling salt or And it just balls up and just becomes a mess. So you really have to massage it into any area that you're using. If you have a tracheostomy, I know a lot of spina bifida folks do not, but there are some that have trachs where that's the stoma to breathe from. You never want to use powder around a tracheostomy. So you'd want to avoid that if that's part of your care plan.
A particular brand, would you recommend a particular
Oh,
brand?
well, if you know, I like Zeasorb powder, Zeasorb. It is, again, big box stores have it. I think Gold Bond is fine too. Yeah, but just some type of kind of moisture wicking powder, especially in those summer months, especially between the toes, so a lot of people will do a really good job cleaning their feet, dry in between, massage the powder in, then put their AFO socks, their AFO and their shoes on. And it will help to kind of keep things intact for the summer months. Oh, thanks. Somebody put that up. Nice.
If you have a wound,
Yep.
is there the best way to wash it?
Yeah, that's controversial. Soap and water's fine. You could use antimicrobial soap and water. There's been a little bit of a game changer in our clinic. We never used to recommend a certain kind of cleanser, only because, again, our insurance company partners do not pay for wound cleansers. So I often felt bad recommending that somebody buy something out of pocket. But we've had some really good results with a product called Vashe, Vashe. It's a hypochloric acid, and it isn't acidic like in a burn sort of way. But what we have found is that if you take the Vashe and you put it on clean gauze or a clean paper towel and you put it against the wound for 5 minutes, that's considered a Vashe soak. It kills a lot of the bacteria and promotes wound healing. So it's kind of the first time in 20 some years that I've ever recommended a certain wound cleanser, and that's Vashe. It comes in a blue bottle. You can order it on Amazon. You can order it through Walgreens, and some of the durable medical equipment people are carrying it, but if you do Amazon, you're gonna beat out the middleman and not pay the upcharge.
How about you recommend anything to add to your bath for skin health?
I don't necessarily. I know some people like Epsom salts. That's not going to be like for skin. There's nothing harmful about that. I would just use just mild soap. If you have a wound, we don't recommend that you soak in a tub because you have an increased risk of infections, sitting in stagnant water. We recommend that you shower thoroughly with a wound. But I don't have a specific bath product recommendation.
So I want to say a couple things. There may be some more questions. They are.
Yeah.
We will be including the Did You Look information in the resources associated with this talk.
Yeah.
To reiterate what Jenny said, if you can do anything to prevent skin breakdown, it's a game changer. And
It is.
SBA is focused really hard on that, and our medical system focuses really hard on care. Thank goodness, right? But the care is long. I don't want to say painful, but it's forever in a way.
It is
2 years, and it's really problematic. So we will include Did You Look information in the resources. Then I want to just reiterate what Jenny said about some things will cause a problem even before you look, like getting close to heat. So that's just remember that, because the Did You Look is so critical. But then some things, if you make a mistake or burn your lap, looking didn't prevent that from happening. Okay,
right.
There's a question. Oh, let's see. Somebody's saying, have you thought about bringing someone to talk about doing an ostomy surgery?
Oh, yeah. I mean, I guess they'd have to clarify that. So I'll tell you my experience with ostomy. So if you get a severe wound, And if it's in kind of your buttocks area, it is continually contaminated with stool, because that's just the area that it's in. A lot of times healing will only occur if you get an ostomy. So they're rerouting your colon to the front, and you have a bag and an appliance. And so I'm not sure if that's what they're talking about or just ostomy in general. I used to think about it as a failure, like I can't heal this wound and I can't control the stool. But I have yet to have a family want to reverse the ostomy once they had it done, because
Absolutely.
it's been so helpful in protecting the skin moving forward into the future.
Right. That's our experience as well, Jenny. And
Yep,
for a lot of reasons, an ostomy has been a positive experience.
right. Very positive.
Any last questions or comments?
I just want to thank everybody. This is a really hard topic. It just impacts so many different areas of life. And I see people really struggling, you know what I mean, to do everything they need to do to take care of themselves. And I just want you to know that there are healthcare professionals out there that want to help you, want to keep you healthy, and want to help you protect your skin as much as possible.
And thanks from all of us to Jenny for your time and for sharing your experiences and expertise.